nurse today. My name is India, and I'm going to be doing a head-to-toe assessment on you today, okay? It should take about 15 to 20 minutes. Are you okay with that? Okay, I'm going to ask for 2 identifiers. Can I have your name and your date of birth?
Wendy Kohler, 10/23/1959.
Okay, Wendy. Do you know why you're here today?
Yeah.
Do you know where you are?
Yeah, the hospital.
Okay, and then what month is it?
April.
Perfect. Do you have any allergies I should know about?
No.
No allergies? Okay. Are you feeling any pain today?
No.
Okay. So my patient's level of consciousness is good, and she's alert and oriented ×4. Now, Wendy, if I could have you stand up and then just go walk over to the wall there really quick for me. And now you can walk back. Thank you. Okay, so my patient's gait is nice and symmetrical and very firm. She's not wobbling or anything like that. Wendy, do you know your height and your weight?
Yeah, 5'4", 150 pounds.
Okay, so 5'4", 150 pounds is going to be a BMI of 25.7. Now, Wendy, I'm going to just verbalize now my general survey of my patient. Her behavior is not erratic. She's acting very normal, dressed appropriately for the assessment today. She seems to be, well, she's very alert. She's responding to all my questions, so I'm not concerned about any hearing issues or anything like that. So now I'm going to start with assessing the skin. Okay, so if I could have you put your arms out like that. Thank you so much. Okay, so nice and warm with palpation. I'm assessing the skin color is nice and even and appropriate for the ethnicity I read in the chart. I see some macules here, and then I do see a lesion here that does match what was in the chart. It's just less than a millimeter in size, and the patient said it wasn't giving her any pain. It's healing. Assess for skin turgor. Okay, nice elasticity with that. And then now I'm going to assess for capillary refill. Okay, less than 3 seconds, indicating good perfusion. Okay, Wendy, you can put your arms down now. Thank you. And then I'm going to move on now to assessing the head. So the head is normocephalic, it's midline. And as I start to assess the scalp here, I notice that the hair is evenly distributed. I don't see any infestations or lesions. When did you dye your hair?
Yeah.
Okay, so I'm seeing the difference in color is appropriate for hair dyeing. And then, so I'm going to go down now to your eyes. Eyes are nice and symmetrical, nice even palpebral fissures, and I do see some wrinkles, which would also be appropriate for the age in the chart.
Sorry.
Okay, if I could have you just look now straight ahead from me, okay? Thank you. Perfect. And now if you could look midline at my pen here. All right, perla is intact. I'm going to go on to your ears now. I do not see any redness or inflammation or any lesions. Does it hurt when I do this?
No.
Okay. Now for the other ear. I do not see any redness or lesions in this ear either. Does it hurt when I palpate here?
No.
All right. I'm going to look in your nose now, okay? I do not see any discharge. Everything looks good in the nose. I'm going to plug one side of your nostril. I'm going to have you breathe in, okay? All right. I'm going to do the other side. Breathe in. Did you have any difficulty breathing there?
No.
Okay, so nice and patent with the nostrils. And now I'm going to go on to assessing your mouth. So there's no lesions or no lesions in the lips. They're nice, pink, and moist. Can I have you open your mouth for me? Okay. The moist mucous membranes that are pink. On the buccal side here, the tongue is nice and pink. And then can I have you say ah?
Ah.
Maybe stick your tongue out a little more.
Ah.
All right, perfect. Okay, so the posterior pharyngeal wall is also pink and moist, and the uvula rises with phonation. All right, Wendy. Now I'm gonna look at your neck really fast, and I see that the trachea is midline there. And then I'm gonna ask you to do some movements, okay, with your head. So can I have you look to the right? Can I have you look to the left? Can I have you look up? And can I have you look down? Okay, can I have you touch your right ear to your right shoulder? Can I have you touch your left ear to your left shoulder? And then can I have you shrug your shoulders? All right, perfect. Thank you, Wendy. So that was good. I'm going to rate it at 5+ for active range of motion, and now I'm going to do the strength against resistance. So can I have you look to the right for me? Thank you. Can I have you look to the left? All right, I'm going to ask you to look up. Now look down. Okay. Can you put your right ear to the right shoulder? And now the other side. Perfect, thank you. And then one more. Now shrug your shoulders. Thank you. So we have noted strength of resistance, which is good. And now I'm going to assess the range of motion in her upper extremities. So Wendy, if I could have you put your arms out like a zombie for me. All right, thank you. Can I have you put them out to the side like an airplane? Can I have you put them up above your head? Can I have you scratch the back of your head? And can I have you tap the back of your back? Thank you. And then how about you throw back like a softball, underhand? Okay, thank you. And can you do your left arm as well? All right, perfect. And I'm gonna have you put your arms out one more time. And if you could bend at your elbows for me towards your face. All right, and then go back out. Okay, and now if I could have you go like this, like you're waving goodbye. And if I could have you go like this, heck no. All right, thank you. So, and then as I'm looking, I don't see any inflammation or anything wrong with her joints. So her range of motion and the joints were good there, as well as the active range of motion. Now I'm going to do the same things, but with a little bit of resistance added. So could I have you put your arm up to the side here, and I'm just going to bend it. So you have to go like this. All right, and I'm going to ask you, I'm going to add some resistance here, okay? So can you pull against me? All right, can you push against me? Thank you, Wendy. And now we're going to do the other arm. So put it up. All right, can I have you pull against me? Thank you. Can I have you push against me? All right. And then one more, we're going to do with your arms out forward like this. Can I have you push like a gas pedal? And then can I have you pull back against my hands? Okay, thank you. So noted strength against resistance there, which is good. And then finally, I'm going to have just a look at the radial pulse to make sure that it's symmetrical and it's there. And note the rhythm. Okay, the radial pulse is bilateral, so I do see it on both arms, or feel it. It's about a 2+ amplitude, which is normal, and there's no irregularities to it. Okay, now Wendy, I'm going to assess your breathing. So what I'm going to do is, first I'm going to say that her transverse anterior posterior diameter I would chart as normal. I don't see any barrel chest. I would note the costal angle being less than or greater than 90 degrees. My patient's is less than 90 degrees, which is great. And so now I'm going to auscultate for breath sounds. Wendy, if I could just have you breathe normally for me, okay? Mm-hmm. And I'm going to be using the diaphragm. Okay, thank you so much. If I could have you get down just for the video, I'll have you kneel and turn around. Okay. So I'm going to listen to her breath sounds now posteriorly. Thank you. to the side. Thank you. Okay, I'm gonna do the other side. All right, thank you, Wendy. You can sit back down. So I noted clear vesicular breath sounds throughout, which is normal. That's great. So now I'm going to do the cardiovascular assessment. So first I'm going to assess the carotid on both sides. Okay. Again, it's normal. I could assess the rate. It would have to be between 60 to 100, and it's nice and symmetrical, and a 2+. Okay. So now I'm going to listen to your heart sounds. So first, I'm going to use my diaphragm. Just breathe normally for me. Okay, and now I'm going to use the bell to listen in the same locations. Okay. I didn't hear any irregularities there. I didn't hear any murmurs. And then what I would do next is I would assess for the PMI. I would do it for a full minute. It would be where I just listen to the mitral valve. I'm just not going to do it now on the camera. And then now I'm gonna look at your abdomen. Is that okay with you? Okay, so if you could lay down for me. Thank you. Have you experienced any pain there lately?
No.
When was the last time you urinated?
About 2 hours, hour ago.
Okay, and then when was your last bowel movement?
Yesterday.
Okay, do you have to go to the bathroom now?
No.
Okay, great. So I'm going to start with inspecting the abdomen. I'm just gonna put your shirt up here. Okay. So the abdomen is nice, even in color. It's nice and flat. I'm not seeing any areas of redness or any lesions. I do see some macules, and then I do see some vascular lesions here. They're less than 1 millimeter in size. They kind of look like petechiae. Okay. Now I'm going to auscultate. nice bowel sounds there, gurgles and everything. And then now I'm just going to palpate, okay? Let me know if you feel any pain or anything, okay? I'm gonna start here. Okay, I'm not feeling any bumps. My patient isn't indicating yet there isn't pain. I don't feel tenderness. Okay, thank you, Andy. I'm going to put this back down and you can sit back up for me. All right, and now finally what I'm going to do is I'm going to assess the lower legs. So I'm going to just pull up your pants here. And as I'm assessing the lower legs, temperature is nice and warm. I do see some petechiae, but other than that, the color is nice and even. And I'm going to assess the pulses here. All right, and then I'm gonna do range of motion now. And the pulses were equal and bilateral, they're symmetrical on both sides. Okay, so now if I could have you put your legs out in front of me like that, both legs.
Both?
Yep.
Sure.
All right.
Okay.
Now go put them down. All right. And can you put your legs out in front of me again? And now could you pretend like you're pushing a gas pedal and then try to go behind like that? Yeah, there we go. Okay, thank you. And I'm just gonna apply some resistance, okay? Okay, can you push down for me? Okay, can you push up? All right, thank you. And can you pretend you're pushing on gas pedal? Now pull back. All right. Well, thank you, Wendy. That's gonna conclude the assessment for today. Is there anything else I could get for you today? Do you need like a drink of water, anything like that?
No, I'm good.
Okay. So I'm going to perform hand hygiene. I'm going to make sure that that the bed is in the lowest position, that it's locked, and that the call light is within reach. And yeah, that's it. So yeah, thank you.